grab Susan sometime and ask her some of the things she's seen. Because you'd have no experience with this machine other than seeing with us. But the last seminar we did in certification a year ago, what really caught my attention had this little boy that had really bad, the person was just actually at the hotel on vacation, and they saw what we were doing out there, and he had a rash from head to toe. And they treated on him, and within one session he was about 50% better. And so that caught my attention, obviously. But I've seen that a lot. I've had families of 6 and 8. I think, how many kids did Oz have? 6? So all 8 of them have gone through the treatment protocol. And so they asked me, well, how do I afford that? Normally we run on a person at $75 for one session. We used to charge $125 for the initial session. It took an hour. The first session we normally take about 20 to 30 minutes tops. You guys do? So we can do the explaining, understand what it is, how it works. If someone wants to prepay for the 13 sessions, it's broken down into 13 groups. It's $60, per 13. So 60 times, you probably know the number. 720. Okay. If they want to prepay for it, the second person that comes in is down to the 50. The second person, 55, and the third person is 50, and then everybody after that is $5 less. So what we do, so when this one family came to me and said, look, we want our whole family to do it because they all have a lot of allergies, I kind of went through my head, so well, you know what, I could run it every 10 minutes. That's if you had a family in there. Andrea was doing that whole family in about less than an hour. So she would see doing 8 people in less than an hour. I was paying her, per one she was doing too.
Do you do a time frame like 2 weeks from?
We don't run 2 a week.
I mean, as far as like when the first person starts to when the rest of the family members need to come in to get that benefit, or you just
no? As soon as they want. No, I tell people, I'm one of those people. If your first family member does it and the next family wants to do it, I don't care if it's that week or in a year. If they're in the same family household, to me, I don't care. They're coming back to me to get the therapy done. But typically what happens, and I've seen this happen with a couple families, one will finish it, and the next person will start. And so it's been really good for like families with kids, where they're real picky eaters, their stomach hurts all the time. My youngest son, he likes to eat dog food. Okay, so he'd have stomach pain on and off, and for that last summer, he was saying his stomach hurt like every day. My wife, every time he talked to her, my tummy hurts. I'm like, well, let's bring him down. That's one of the people I treated when he came down. Within the first session, he said after that, he said at one time his stomach hurt. After the second session, he never said it again. So what showed up on him was a lot of parasites and stuff. I knew that because he was dipping the dog food in the dog dish that we're drinking water out of.
He got that from his dad.
I get hungry sometimes. So anyway, as far as we'll be happy, Dr. Myers and myself, Susan kind of talked about how we kind of have structured the financial aspect of it. In my office, the nice thing is it's just nice because it allows me to do all that allergy work I've always wanted to do with people, but I don't like doing the vials. I just don't like. I like doing it, but I hate putting it away. And then you have to put tape over them because your hands are slipping the things off. But anyway, it made it nice to be able to really do the assert work the way I think it should be done. And so it's been really kind of fun there. So we're going to run one person on this. You can see how quick it is. And then we'll go from there. So anybody who wants to do it? Okay.
On my chair? Yeah.
Okay. Go ahead and take your shoes and your socks off. You should make Susan run. Susan, do you want to come run it? I'll let her run it so I can kind of talk to you guys as she does it, so she didn't have to. So how much training have you had, Susan, in this? Like, how long did it take Andrea to train you on how to use it? How many times?
I think that after 2 times of being with her, I was running it.
For how long? So like hour, 2 hours, something like that?
2 hours.
Yeah, so maybe 2-3 hours of training is all that basically she had before she ran the machine. And so that's kind of nice if you can take somebody that at least had the desire to want to help people. I mean, my son, who's 13, when my dad first got his machine, we went over to my dad's house, and my son ran it on me. Okay, so the nice thing about that is it's simple enough. As you start to understand what it can do, you can take all that knowledge you have as a practitioner, and you can pick and choose doing things. The way it's designed, what she's going to do is she's going to put his name in here, height, weight, no, shoe size, no. So the name, and then it actually has specific protocols. So it's broken down. So when we do the total scan on somebody, right, we check the adrenals, and then we check the electromagnetics, right? We check for switching and all those things. We check all the organs. What we're going to do is we're just going to choose program A. Okay, well, don't start it yet.
What is that?
But go back. Okay, so she's going to choose program A, which puts these in here. It says allergy list A, digestive system, emotions, endocrine reports, flower essence, immune system, lymphatics. Go to where you can add stuff.
This is a different program.
Yeah, it's a
than
different
mine.
one, so go ahead and hit that. Oh, yeah. And
Creating a program?
right there.
This is different from my program.
I just uploaded the new one.
Scan.
It's just
So
hit
just want me
scanning.
to run scanning?
Well, click, just while we're playing, hit new program, and let's just see if we can go ahead and do. I just put, let's just put certification on it. And then put 2012. Yeah, okay. Let's see what's showing.
Here it is, but we have to
Double click it and see if we.
put it in folders. I just don't.
So we'll play with it in a minute. There's probably, we'll figure out the format, change the format. It's just scan A. So what scan A is going to run is these things. Go ahead and click scan B so they can see it real quick. Sorry. So if you hit scan B, see how it changes. Set hourly list B, then amino acids. It changes what what folders it's going to run through. Okay. Go hit scan C so you can see.
So those are the 13.
So those are the 13 ones. Go to scan M. So if you go all the way down to M, you see how it has everything. So you do each one, and then the last one is M, which is basically retesting everything. And then we take a 3-week break, and then you come back and scan that one again. Okay, so you can typically, once somebody's gone through the whole protocol, every month to 3 months, you can bring them back in and run scan M and reset them, recalibrate them to what they're actually processing at that time. Right? So we have specific ones we've designed, which this is not just my laptops are not saved on this one, for different situations. So if somebody comes in with autoimmune condition, we kind of have one we do there. We have one specifically designed for hormones that we kind of put together that we really like to run on people that are struggling with hormones. Okay, that you can always add to the scan you're running. Let's just do scan A then. Right, so once you hit that, he's got this cup on him here. And what that is it's got multiple contact points. So when she hits start calibration, see it has a little sine wave. It's just to make sure it's getting a connection to this. So the way I explain this to people is she's going to hit finish and just hit start. They're going to start scanning, and what's happening, each one of those points, animal fat, B complex, okay, that's like testing those. If you're muscle testing, be like, okay, I just tested that. So you can think every time it goes down, that's how many different things you just ran through in muscle testing. These lines over here basically represent the reactivity. If there's no reaction whatsoever, it's just right along that line, that middle line. If there's a high reactivity, you'll see it spike. I tell people it's kind of like a lie detector. So what happens when you lie? What happens to your heart rate? It increases. What happens to your muscle tone? Tightens up. So those are called stress responses. So if you eat a food, can it cause a stress response? If you're in a bad relationship, can that cause a stress response? If you're exposed to toxicity, what can that cause a stress response? So what you're doing, you're checking electrical signals that the machine's picking up on that stress response to find out what you're most reacted to at this given moment. All right. And at the end, once it goes through these, and you also look at checking emotions. All right. So after it goes through this, we're going to come back and it's going to actually find out what balances those out. That kind of makes some sense there. So this makes you a really really quick, fast muscle tester. All right.
How long do you usually hold the metal imprint of that? How long do you keep that on?
How long will the imprint stay in here?
Yeah.
The imprint will stay in here really forever unless you magnetize it. So like this right here, this is a big, like a strong magnet on the end of this. And so, like how long does your credit card last?
Usually a week or two.
So,
It's maxed out.
it's maxed out.
Yeah.
But on your credit card, that credit card is a magnetic thing, right? So it works fine unless you do what? you put it on a magnet or something like that. So we're gonna, let's do the band.
Band?
Let's give him a
Okay.
pink one.
That's why I have.
Would you
So we're gonna be
promotional
nice,
stuff.
you guys.
Yeah.
There's two ways you can imprint the frequencies into these. Okay, you can imprint them into a BB, a metallic BB, and put it on an acupuncture point in the ear, which is what we do a lot with kids, because the young kids like my 5-year-old, we did this because he wouldn't wear this. All right, teenagers and up, pretty much they do the band. Right. So what she just did, she took one of these bands. I don't know what colors you gave him. I just gave him the pink.
I gave him blue.
Blue, nice guy. Right, and then she put the magnet across that metal piece, and she's gonna put it in the well here. Okay, what that's gonna do as it goes through and you find out what balances him out, it's gonna put that frequency into that band. Does that make sense? Okay, it's gonna put that frequency into that band, so every time he wears it, what's that doing? Bringing his body back to balance. Now, will his body change? Absolutely. So that's why it's broken into 13 sessions. If you ran that M1 on him, you can't treat everything. There's just too many things to treat. You're going to choose the top 3 from every category to work on or focus on. Okay? So go ahead and hit it. All right, so when it shows up in here, let's go to list A. Care if we talk about you?
No.
Okay, good thing. Okay, so what shows up here is the B complex mix is one of the most reactive things he is, and then wheat is a second. So when as a practitioner, when I see this, if they're eating gluten, I know they're asking for trouble. Because they're reacting to it. That's what I've seen. I hate it because it showed up on me. Okay? And I kind of ignored it, and I retested again like 4 weeks later. Guess what? Still showed up. And it stinks. Anything above 900, we're going to choose. All right? Say 884, it's pretty close. And if I knew he was having reactions to dairy and stuff, I might throw that in. Okay? What we're going to do,
Dairy?
okay, so she's going to throw that in. So what we're going to do is she's going to go ahead and take, and what she did, she's hit, see that little button that's flashing yellow? It says add item from each folder, and it says 3. You're choosing the top 3 for every category. She already has chosen that. Then she'd go through each one and see if there's anything above 900, and we want to click on those as well. Because anything above 900, we want to let the body focus on. Okay? What digestive emotions? I can't see those. What's the top one?
Justified.
Justified, anxiety, puzzled, insight, fright, ecstasy.
That's exciting.
Okay?
Gotta stay away from that stuff.
Stay away from that stuff. Stay with the ecstasy. What's interesting as you do this on people, a lot of times they're very surprised at how accurate that is.
Betrayed, you're revolted.
Now, is it possible that some of those emotions, you'll see this happen, it's possible that they're not your emotions. As a practitioner, is it possible you're picking up on other people's emotions? Or if you're married to a spouse or something like that, you're going to pick up on other people's emotions. So a lot of times when you read these, you're thinking, and you see it, well, that's not me. You think about, what am I doing within that my situation in my life right now, or somebody that's really close to me. Okay. And again, this just goes through the immune system, lymphatics, nervous system. She's just going to choose anything that's above 900. We're going to put them in. So think about, you go through your house and you decide, okay, I want to clean this, 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 and this, and this. And if your wife was there, she'd say, I want you to clean everything, right? But you'd say, honey, just give me the top 3. Right? So what we're doing here, we're trying to look at, okay, what are the most important things to the body right now? All right? We're going to put them into this little well here, or in the computer, say, this is what I want you to pay attention to. How do I balance this out? Correct. There's more things you could do, but they're just not the priority. So on this guy, on him, is what I'll say with like people that come through and food's their major thing. Like they may come in as a new patient, they have no idea even having this machine, and they're coming through and they're just talking about allergies and all this. What I'm going to do is I'm going to basically show them how much is actually reactive, and knowing full well that we can't treat them all. You know, because you can't, if you try to give the body too much to do, what happens? The body revolts and gets sick.
When you say can't treat them all, you mean at one time or over 13 sessions?
You can do it over 13 sessions, but that's why it's broken into 13 categories, because to test everything and then to try to treat it is crazy. So we're going to get a potency scan. Potency scan is going to take all those ones we put the priorities, and it's going to then go through another series of sequences to find out what balances his body out. And really, if you're not talking about it, and as you'll see, as Dr. Martinson's out there running it, 10 minutes, 10 to 12 minutes usually. But we're going to book in 20 minutes so you guys can ask questions and stuff like that. But in my office, we book in 15-minute increments is how we book the machine, just in case somebody runs over or behind or whatever. But I've seen Andrea do 8 people in an hour multiple times. You know, so as a practitioner, I'm not running that. So for me, it's an added benefit because it allows me to do the work I want to do, it allows me to treat people I wouldn't normally treat, and then it also creates another revenue source for me. Okay, and so it fits all the categories to me as a win-win. So it helps the patient, helps me. Right, so what she's done, so how many of you have used another form of like bioburden or something like that? Okay, how long does it take you normally to run that? What's that? At least 30 minutes. That's if you're fast. Okay? So if we're not talking and doing anything else, it'll take you 10 minutes to find out what it is, verify the work set, and treat them.
You cross your right ankle.
So you can book it. So what she's going to do is she's going to have him cross his ankles, and then when she hits therapy, what's going to happen? See on the wall? There's violet, red, and green. So the frequency is being passed through the laser, and we're going to treat very specific points. Points on the ear, okay? Points on the heart, on the spine, just like we would with the assert. What do you do with the assert normally? Okay, you have them breathe in and breathe out, and fire breath while you go up and down the spine. We're going to do the same thing, but using the laser to do that. Okay? At the same time, these frequencies are being passed through the well into that bracelet. So once we're done with the therapy, you can also have them wear the bracelet. Okay, so it allows them to rebalance out. So what she's doing, she's treating all the auricular points in the ear,
Switch your ankles.
and then she'll switch the ankles and do the other way. So she'll do both sides. Right leg over left leg over right. Do the ears twice, do the spine, and then at the very end we'll do the same points we used to use for assert, right? For the hands, elbows, K27, down the ankle, stomach 36, spleen 21, liver 3. The same points, but you're running through it. So someone that's already doing a lot of assert work in their practice, having something like this takes you to a whole new level of what you can in fact do.
Well, you know, sometimes we don't even do it just because, like you said. it's
Because
just
yeah,
such a-
I did it, but I did it only on complicated cases because in a 15-minute visit, I don't have time to go through the vial, find the vials, put the vials back, do my notes, and go on. Drove me crazy. Now, what are you noticing that she's doing this? What are you feeling? Nothing? Feeling any relaxation in your tissues? 'Cause right now you're starting to relax right here. I don't know if you noticed that.
Film.
Okay. Many people, as they're doing this, they'll feel areas of their body that are tight and begin to relax. So what I'll do sometimes when I'm working on you guys doing it, like I was doing this on Dr. Lee earlier, what happened to your shoulder range of motion and also your muscle strength when I tested over your heart after we did this? 100% different. What, do you feel anything different now than when we talked?
Just more relaxed.
More relaxed. And you were pretty tense when we started. Okay. So the nice thing about using this, I like, it opens up avenues for me to communicate or talk to the person, because sometimes as you look at the emotions on here, it's what's going on in their life. It allows you to open another door. So that's why a lot of times on a new patient that doesn't even know anything about this, if they're really complicated, if I have extra time and I can have Andrea run that on them, I'll go in there and talk to them and say, this is why we need to use stuff like this on you. Because we've got to look at all these factors that are involved in you getting well. It's kind of a fun little tool to take to different health shows and stuff too, if you like doing that. So I've done that several different times.
How do you propose this to the patient?
Okay, very, very, very good thing. So how do I propose this to the patient? We get a lot of personal referrals from them now, but if somebody's coming in and they're coming in and they have allergies, I talk to them about that and say, what we need to do is identify what you're reactive to, but not only find out what you're reactive to, and find out ways to help your body not react to them. So how many of you in here have heard of somebody using allergy shots before? Okay, what's the typical treatment protocol for allergy shots? How long are they doing those for?
Forever.
Sometimes forever, and sometimes for years. How much are those? They're extremely expensive, and they're a lot of very time consuming. Okay, what's the concept behind an allergy shot?
Yeah, it's okay.
They're trying to build a bridge, so they're giving a little bit of substance in order to try to teach the body not to react to it. Okay, I tell them we're kind of doing the same thing here. What we're doing, we're not using a shot, we're using the electronical frequency of the substance, and then using acupuncture points, or you can call them reflex points if you don't do acupuncture, to train your body not to react to them. And I said you can do allergy shots with that same concept, but if you do this, you'll get that response. We don't have to use shots, we don't have to use nutritional supplements, but I still do a ton of nutrition, because in my opinion, if you don't address the nutrition, it's not going to make it as good as it could. Even though with this, I've had people that were eating foods that they're not supposed to not react to them now.
it's even better because you're balancing out the emotions and the organs to the
all at the same
allergies.
time.
Yeah.
Yeah.
Which are-
But you have one, right? Yeah. So, and you can grab him. Again, I didn't want to buy one, but when you start doing it and you start seeing the results, like that young kid that his dad owns that one network marketing company. You tell him about that real briefly.
That he
He
can't.
owns like a Groupon. His dad does. He's
Yeah.
got a Groupon type site.
And he brought his son has some pretty severe pollen allergies, and also had some really bad acne. So I've treated him. I think he's had 8 sessions, and he's a different kid. His skin is completely clear now, and he hardly reacts at all when he's out playing baseball with his pollen allergies.
And we introduced him to that because they were trying to they wanted to run a Groupon, just put something in Scottsdale of this machine type thing. But the dad, like, I don't know anything about that. So they brought his son in. I'll be very surprised if the other siblings in that family won't come in and get it done too. It just works. It's really kind of fun that way. Okay, so they put the band on him, which is nice, because then you're getting treatment, plus he's remembering you every time he looks at that bracelet. And you're in fashion now.
How does the band treat? I mean, how does it, what does the
Okay,
band do?
because the band, it has those frequencies, those codes that we just use to balance him. So when that is actually on him, it's actually changing his vibrational state, is what it's doing.
Affects the meridians or something?
Absolutely. Okay, just like a magnet. When we wear a magnet, how does that affect you? It actually affects your energy. Okay? Any questions on that? So,
How about someone who's like gluten sensitive or, or even celiac? Have you seen any changes that they could eat gluten again, or?
I have seen people that were sensitive to gluten eat gluten again, even when it tests low, I still don't like them to do it.
Right.
Like, I still will eat some gluten now and again, but mine doesn't show up very high anymore.
It used to, now it doesn't.
But
as
yeah,
much?
and you'll see it go down very
It will
interestingly.
go down.
We have several kids that they just couldn't eat hardly anything, are now eating almost anything they want, even though we still want them to eat good. I mean, that's the whole concept we try to teach them. Like, this isn't to make it where you can eat crap.
Let
How
me tell
about-
you what problem we had though. It wasn't this machine, it was another machine. One of the doctors tested somebody and they had a known allergy, and they said, okay, you don't have to worry about it anymore, and he had anaphylactic shock. You don't want to do that. And so anybody's gluten sensitive, I tell them to stay off gluten for the rest of their lives. I like to really work this out where I feel comfortable, it totally takes care of it. Like celiac, I would never tell them to do it. But I think they're going to be able to cheat once in a while and not whack them up. But I tested gluten sensitive 3 years ago, so I've been off of it ever since. I still don't eat it, even though I check myself constantly on here. I don't think it would bother me, but I'm not about to find out. Genetically, I had genetic testing done, and genetically I'm predisposed for it. So I'm just going to really take care of my epigenetic expression. I think eventually we'll be able to rewrite the script. I don't think we're there yet.
How about as far as like environmental allergies?
Yeah, environmental allergies, seasonal allergies. I mean, great response. I know, my nephew that's got anaphylactic to peanuts.
Right.
We've gotten to this response, and he actually got a hold of peanuts, eating something else,
Yeah.
and he had a minimal response. Like, it didn't affect him near like it used to. And he used to be very hard. He's emotionally struggling, as far as hard to deal with. He does phenomenally better now. And I know that this doc here was talking about how he's seen that. Like your daughter, peanuts.
Yeah. My wife is actually gluten sensitive, and my daughter had severe anaphylactic peanut allergies. And I think we had her kind of figured out beforehand before we did this, but she was exposed. She's just too smart to eat the peanuts. But she had an egg, eczema all over, an egg sensitivity, and now she eats omelets, and it's not a problem. The peanuts she was exposed to twice last summer, and had zero reaction. The second time she had 5 bites of peanut butter Rice Krispie treat, and she was stuffy nose like that. But
Well, there are people with like chronic sinusitis and chronic.
Well, I have a chiropractor that actually is in Mesa. Actually, not Mesa. He lives in the valley here.
Right.
He comes over to me to this, and how much weight do you think he dropped? 20 pounds?
He said
15 pounds?
it was over 20.
Almost 20 pounds. He had chronic sinusitis. He was taking like the whole, what's the Afanex or all the time. Not at all.
Justin, that kid was in there this morning. He was on 3 allergy medications.
Off of
He
him.
stopped them himself.
Yeah. And so again, I've seen it.
Like that.
I'd seen it enough times that I have very good confidence that it worked. I mean, it's almost works too good. But it's really fun to be able to know you can have that effect on somebody. You know, so that's, again, the shirt work works, but sometimes it doesn't work, I think, because there's so many other complications there. Like with this, you know, you're looking at emotions, you're looking at toxicities, you're kind of combining all the different things that actually cause those reactivities. I think that's why we see results with this we didn't quite see with the insert.
Right.
So even though you're saying even 1, 2, 3 treatments, you're seeing the results.
You'll typically see some changes, but I'm wanting them to go through all 13
Yeah.
because you're trying to really change the whole system and how it functions.
Do you-
Because you're not going to get to some of the stuff till for later.
Do you sell it or propose it? It's a package. It's 13. That's it.
No, I tell people if you want to do just one session, it's 75. Instead, and we'll try to do it that way. It's not my favorite way to do it because I think you know, when you have an allergy, you have other dysfunction going on, and I want to address those other dysfunctions. But I'm also not going to turn them away if that's all they want to do. And so I would rather do all 13 because I get the best response there. If somebody's severely sick, you're dealing with autoimmune condition or something like that, to me it's just part of it.
Wouldn't they kind of get the concept if you're talking to them about allergies that yeah you can't do it one time? I mean it's allergies just like anything you're allergic to. This.
That's why I talk to them about the whole puzzle, but that's also why I talk to them about allergy shots. Most people that are coming to you for allergies, they've gone through allergy shots, or they've been using this or that. They've gone through rotational diets. You know, and this will be more and more common, but there's not a lot of these in the country. So it's just a great tool to not only use for me to help identify it, teach them about their food, teach them about their activity, but how many of you guys in here see autoimmune cases every week, all the time?
You are whether you know it or not.
They're there.
Well, you gotta find fibromyalgia.
And this is where they're starting, is with really true with reactivity. So don't call it an allergy, call it that your body's reacting to things that it shouldn't react to. So it's a dysregulated immune system, which is exactly what an allergy is, which is the same thing autoimmune condition does. You know, and so this allows us to hopefully catch that, help them identify it, and actually help change it.
Brett, would you use this like on Crohn's or fibromyalgia?
I absolutely, that's what we use it with. I mean, we want to do all the 6 steps. This just,
Right.
so I think this to me is like the allergy section of the 6 steps. This is like the assert section, but it's like on just serious steroid. It allows you to actually see it, change it, and then see the responses. So everything else we've been doing just works that much better. And that's the cool thing about it, you're just doing everything else that you've already done, but now you're really addressing that allergy component, identifying them, and then neutralizing them to a higher degree, so your results just huge. And as far as from a practice standpoint, you know, spending $30,000, that's a significant investment. But when you're spending 30, and then you're generating last year probably closer to 90 off one machine, that's pretty nice. And it's rewarding for the staff too, because it keeps them busy when I'm gone. So if I'm gone in scout camp for a week, which happened this last year, you know, and that machine's generating income, that makes me feel a little better. Plus my patients are there getting care that they need. So it leverages you as well as you get results, and it's saving you time. So it's just a nice tool.
Dr. Brett, that one family that came in, I know, how did you get a whole family doing it?
That's what I was telling her. So like that family, the one family came in because I knew she had real bad allergies. So that first week I called her because I knew, I said, you need to come in and check out this machine. So what I encourage you, if you got to consider anything getting the machine or going to get the machine, when I was at the seminar, I'm like, okay, if I'm going to do this, this is what I'm going to do. I started writing down all the names of the people that I could think about that would benefit. And then I had my staff call and I called. I said, guys, we have a machine we're going to have for 1 week. I think it'd be very helpful for what you have going on, both with allergies and migraines, the stuff that I really thought we needed to be doing with them. Well, that's why I paid for the machine so fast. Is once they came in and saw it, like that one, she came and saw it and she understood what it did. She's like, well, I have 6 kids and a husband that need this. I said, well, and so I went back that night and I went through, okay, so how do I make this work? And I started thinking, well, if someone's going through allergy shots, they're going to spend thousands of dollars. I said, well, the first person is 60, second person is 55, third person is 50, if you want to prepay for it. And they prepaid for everybody at once.
You never go below 50 then?
I think, is that the lowest we do, 50? I think it goes to 50. You know, but a lot of guys are using this machine, like we were charging $125 for the first session to use our other machine because it took us an hour to run. How much do you charge when you run yours for a half hour? 60? Yeah, that's cheap. But, you know, if you go, a lot of guys are charging $125 for one session, allergy session. 100 to 125.
The person running it had to know what they were doing too.
Yeah. This one's just, it's really, I mean, Susan's smart. I mean, a lot smarter than me, but it's just, Andrea trained her really in 2 different times, maybe an hour apiece. So the training is very simple to do. It's just, and that's part of what we'll do is Andrea, who works in our office, and Dr. Marks and I will actually make sure you're trained in how to use it.
There's a couple of pieces of that puzzle. They designed it so even a chiropractor could do it. That was their technology because 2 chiropractors developed it and worked with the researcher to do it. The second part was the first time I did Dr. Brad, I had his son, who was 12 years old at the time, just watch me, then I had him do one. He did, after watching one time. Of course, he's 12, he's a lot smarter than we are, and he's not programmed that he can't do stuff, but he did it one time. The other piece of the puzzle, somebody asked me, well, how would this do everything that the Zyto does? Well, the Zyto is kind of cool because it's inexpensive to get into. You put your hand on the plate, it does all the reading for you, but remember, it's only a single channel. It's reading 1 channel of energy at a time. This is 8 channel. It's reading 8 times as much, and it's correlating much more. A Zyto can also tell you what nutrition to use. This can do the same thing. It just, you can program all this in there for all the Zymogen nutrition. We're working on that right now. We're just trying to wait till we get my products all out so we can do that. You can just run a patient just like that, put the cuff on, run through it, and say, this organ's out of balance, that organ's out of balance, this is the nutrition you would use. So this does the same thing too. But a Zyto is less expensive, but that's all it does, is just the screening for that.
Yeah, and
You
something
can't
that
really
you,
compare the two. If I was to say, well, how does a Zyto compare to this or some of the other real complicated ones? The Zyto is like,
slingshot.
a slingshot, yeah, rather than an anti-aircraft missile. It's just a brief
Great,
indicator, and you can't duplicate the results. That's one thing I never did like, even though it's useful for people that didn't do AK. With AK and this though, I mean, I have one, I bought one just for myself and my family to do research with. You have to shoot me to get away from me.
John, I've been doing Zyto for years and it is not reproducible. Is this reproducible?
Well, in a different way, because once you treat with this, you're completely different, you're not the same. But it's just, believe me, when you use this versus the Zyto, you will see what I'm talking about.
Zyto, you can do it the next second, even if you haven't treated. It will give you a whole different set of information.
Yeah, when I played with it a little bit, because one of the reasons why I did it, because when I first ran it, gluten showed up and I didn't want to believe it.
Yeah.
And so I purposely kind of just ignored it, just to see what happened. And about 3 weeks later I tested. I've done that 3 times now and it's shown up every time.
Okay.
Other than now, after I stayed off it for a while, it doesn't show up very high anymore. But because I'm kind of the same way, I like to play with that. But what I'll notice is if you're reactive to something and you eat it very much, it'll show up high again.
Okay.
And I've seen that with a lot of patients. So it's really, again, it's having the success I've had with actual just people with symptomatology is fantastic. And you're talking about acne, you're talking about skin disorders, you're talking about allergies, you're talking about food sensitivities, and these are not kids. Stomach problem for kids that they don't know they're supposed to feel better. Adults with hormones. One lady that worked with me, she had her periods since she started her cycles were sporadic. After she did the hormone, she made up her hormone one because she actually learned how to do it. Andrea, she'd tell you, but normalize her cycle, and she'd been on different hormones and stuff like that too. It's really kind of a nice tool to be able to assess what we're doing and also to be able to kind of help that energetic balance that's there. So we don't want to spend all day on this. We got a lot more to do. So we're going to take this out in the hall. Dr. Martinson will be out there kind of running on you guys, let you guys experience it. You definitely, we don't like to do day back to back, but in this situation we probably would. But I definitely do it today. If you don't do it today, do it tomorrow and try to get some done Sunday. But experience it. If you're considering doing it, if you start making that list of patients right now, and you make those phone calls and you get them in when it gets there, you'll have it paid for. Yes.
So if you were going to market this like outside of your practice, what do you say that it is, and what are you allowed to say that it is from a marketing standpoint?
Okay. At the marketing standpoint, when I take it to people, I said this. What we're looking at with this is it allows us to see what things stress your body. Because we're looking at the stress response your body has.
You don't call it an allergy treatment.
No, I don't. I said we're looking at what things stress your body, and some of those things that stress your body could be pollens, could be foods, could be different stressors. So we're going to find out how your body responds to that. So people understand lie detectors. I say just like a lie detector, if you lied, your body had a stress response. This allows us to look at how different substances stress your body. In my mind, that's an allergy. But when you call it a stressor, it's a whole different ballgame what you're saying. It's really what you say to get you in trouble. And so when I go to the golf expo, which I did last year, and we took it, we're out there talking to people, and they're asking us what you're doing. Well, a lot of those guys have seasonal allergies. And we talked to them about, how's your sinuses when you're playing golf. So sometimes there are different pollens that stress your system. Let's run down this machine and see what shows up. And we throw the pesticides in there, and that are on the golf courses and stuff like that. So it's a nice added tool that you can use. If somebody that I'm talking to, I can hear they're dealing with allergies or arthritises, we throw other things into the mix. So I really look at, again, marketing, I tell them mostly internal marketing is what we do. And most of us have patients already needing this service, but when I'm out in public, I can just call it a stress assessment.
And then what's the follow-up? You're saying it's showing how your body, or what causes your body to stress, what substances your body's stressing out to, and then you said something in reverse.
You find out what body, find out stress your body, then you find out what things actually calm that stress response down.
Okay.
You know,
And that could be the laser treatment.
yeah, and that's why we use laser to we use laser and stimulate points on the body that causes the stress response to change.
Is that what class laser is it?
3? The 3? 3. Okay, I'll have to look at that, but I think that is right. What's that? They're 5 milliwatt lasers, so very, very safe. And it's nice, you have all 3 colors, but if you're dealing with chakra stuff, you have the top of the spectrum, bottom of the spectrum, and the mid spectrum. So you're kind of hitting all 3, both the emotional aspects.
I'm gonna be using the stronger one as well as that one when I get out there. So
What's that?
I'm gonna be using the stronger one.
So he's going to have the 4-watt laser out there, and also show how we would use that in conjunction. So like if I'm dealing with stop smoking cessation and stuff, that's what we use. I mean, Andrea wants me to buy another one of those. I told her no. Because we use it so much, but she'd like to use it on every person she does this with. Because she likes to stimulate the points, regular points, based upon what's going on with the person at the same time. Because the results she gets.
And when Andrea wants, Andrea usually gets sooner or later. Yes, she does.
She tries. She does. She is persistent. She is persistent.
Did we pass around where everybody signed up?
I passed that out.
Okay.
If it's full, we'll pass that one for tomorrow as well. But Dr. Martinson said he doesn't sleep, so he'll do it all night.
I might get through them a little quicker, so we'll grab some at the end.
Okay.
And then-
All right, we'll pull that
this
out
guy already got it.
Okay.
Are we doing it on the laptop?
All down your